at the numbers who have joined us so far, it's amazing because I wasn't expecting these numbers at these early hours, but already we have close to 300 people following us both on the Facebook, YouTube, and also at the Zoom meeting. And so I just want to take this opportunity to thank all of you for your interest, your passion about this work to support the global crisis and what the world is actually dealing with now. And so today I am going to facilitate this meeting, and then I hope and pray that our meeting will be very successful. We've been able to parade some amazing, wonderful guests that I thought are the rightful expertise for this important meeting. As you may know already, the world was caught up, surprisingly, by the COVID-19. I'm sure before the year was about to end, nobody expected that we were going to have this difficulty. But whether we like it or not, it's here with us. The whole world is actually embracing the crisis. But one thing we know for sure, that when there are crises, there is a way by which we also handle us. I would suggest that we to mute our sound so that when it gets to your turn to speak, then we unmute so that we don't get the feedbacks and all that. By the way, so like I said, the world is racing this virus, wherever it came from, however it got here, whether you believe in the conspiracy theory or not, none of those matters. What we know is that thousands, if not millions, are dying, and we have a responsibility to find a solution to this problem. So today, once again, I am very excited and happy that we have this great panel that we're going to discuss and find ways by which we'll be able to handle all these situations around the world. Having said that, I will be your facilitator for today's meeting. I'm excited. I look forward that I will be able to coordinate this meeting beautifully and nicely, so we'll be able to have some good conversation. The objectives for this meeting, particularly, it's aimed to provide a complementary, simple and a reliable information on how to handle the COVID-19 effectively. Also to help participants, and like I said, we have so many participants who have joined us, also to help participants to some way, somehow, find a way to handle these competencies and in a confidential manner, because the way to manage a crisis or health crisis is to have the basic know-how, and then finally to understand the economic impact and the recovery process that is also associated with this event. And so for that reason, I will also want to mention that we are so grateful that the World Health Organization has partnered with the Jacob Sabi Global Institute for Leadership Studies to get this going. So I'm very grateful. I want to thank everyone, including the board of directors and our staff team for joining us as we do this. So let's begin. So where are we now? Now this trajectories was actually done yesterday. And as you know, all this happens on a daily basis. And so because of the presentation, we have to stick with yesterday's own. So it tells you, this map you see right in front of you gives you a glimpse picture of the infection trajectories. Now you see the racing there. You see US, you see UK, you see Brazil, you see Italy, and the amazing thing is that this virus, believe it or not, is changing the way we handle things and the way we behave. And so quickly, I want to share with you the infection and the fatality rates by countries. You can see on the screen, and again, like I said, this was yesterday. As of today, the number has even increased, even the more. That is the most frightening thing, because at every particular point in time, this thing kept increasing and kept increasing. So we can see the confirmed cases, for instance, in the US, as of yesterday, it was 1,069,424. Today, it has gone to 1.1 already. And you could see Spain, you could see Italy, you can see the UK, and it tells you the trend at which this is growing. And just remember, this is just a document from yesterday. Now, when you look on the right side of this, you could also see cases per million. And you could see how it is also increasing, and the number of deaths and the way it's rolling. Now, let's also take a quick look at this biological data. Interestingly though, as of yesterday, we have 37% of women are at high risk, and also we have 63%. Now, how contagious and deadly is this? When you look on the right side of the graph, it gives you the various diseases that we have dealt with. We talk about bear flu, we talk about Ebola, we talk about MERS, we talk about smallpox, we talk about polio, we talk about tuberculosis, and we talk about the Spanish flu, and then we look at the COVID-19. Now, this trajectory helps you to have a better understanding of this coronavirus and its impact. Now, what about the incubation period? The incubation period on the left hand of the screen, you could also realize that the novel virus, which actually has become, more of a technical word that most people are getting to know right now. But with the COVID-19, it falls somewhere lower as compared to other incubating period. Now, one of the recommendations of CDC is that people should wear masks, face masks. I mean, all of us have been told to wear face masks. And so everybody just gets something and just put it on their nose as a way to handle themselves. Now, the best household materials for a mask is what's on your right hand. Of course, the best is the surgical mask. Nobody sees a surgical mask right now again, maybe with the exception of Dr. Chibuna, who is a frontline health worker. But otherwise, majority of us either will use our scarf, and so it tells you the percentage of the quality by which the micron particles are captured when you cough. So if you use scarf, then you have 49% chance. If you use cotton, silk, and all the projections are there. Of course, this work is also being recorded, so people can go back. For lack of time, we don't want to spend too much time on this, so we give our experts. Now, we also talk about the flattening the curve. Flattening the curve. It's very important that in order for us to be able to handle this crisis very well, there is a need for the curve to be flattened. And so in order to do that, there are measures that we need to do in order to do that. And that is why the whole world is talking about social distancing. The whole world is talking about don't panic, just be careful. The world is talking about washing of hands. The world is talking about, the government is putting limitation on the way we gather and all that. These are all important measures in order for us to help the problem. Now, total mention in the media, it's interesting. HIV has been mentioned about 69.5 million times. SARS has been mentioned 63.3 million times. MERS has been mentioned 33.1 million times. And the Ebola has also been mentioned 62.2 million times. Now look at COVID-19, 2.1 billion times. Now, the reason why I brought this slide is that in this dispensation, technology and the use of social media has become a very powerful tool. Depending on how we are using that technology will show how people will either become fearful or people will be able to fight the disease. So if you hear news 2.1 billion times and it's all negative, then you should understand why people are panicking. Anyway, now the average disease per day, and these are all projections, and it's increasing every day. Every day it's increasing. So you could realize that tuberculosis is still killing more than coronavirus. Hepatitis B is still killing more than coronavirus. Pneumonia, HIV, malaria. But again, like I said, when the world hits the panic mood, it gives attention. That is why you could see that the coronavirus has been mentioned 2.1 billion times within this short period of time. Again, ways to prevent, we all know these ways: washing of our hands and doing all the things that we needed to do. And then, how do we win this battle? For me, it is very important, because the only way by which we can win this battle is only when we pay attention to the fundamental things that have been placed for us in order for us to live within the confines of our lives. And that includes, but not limited to, foundational public health, societal compliance, health system capacity. When our health system is choked, we saw what happened in New York, then it becomes a problem in the UK. You know, the industries have to be safeguarded. Otherwise, there will be, the food chain will have a break, and there will be a serious consequences. The protection of the vulnerable, we know that this COVID-19 affects majority of people with underlying medical conditions, and as well as people of a certain age bracket. We need to protect these people. But more importantly, the economy. The economy needs to be safeguarded, because once the economy breaks down, then we have a fundamental problem. All right, so I think I have spoken enough. Today, we are privileged that we have great speakers who are going to do marvelous and give a good presentation. And so we're going to have Dr. Onyari from Kenya, who is going to speak to us about peace and security threat of the COVID-19. We are going to also have Dr. Grace Faraja. I have known Grace for a long time. I still cannot mention her last name, forgive me. And Grace is also going to talk about, how do you call it, the devastating impact of orphanages, as well as, give me a second here. Then we also have Professor Edward Tuaini, who's going to speak to us about, it's an adjunct professor of accounting, and he's going to talk about the economic impact of the COVID-19. And then we also have my good friend all the way based in Uganda, Dr. Anki, also going to talk to us about farm biotrack and different perspective. And so, folks, I don't want to bore you too much. We are still enough speakers for today, so we are going to enjoy ourselves. We have Dr. Chibuna based in California, who is a frontline worker, is an RN and a PhD, and so he's also going to talk to us about the social impact of COVID-19 on the frontline workers. We also have, today, we are also privileged to have Ambassador Ada Okika, a great woman, educationalist based in New York, a great ambassador, who's also going to talk to us about education because she's an educationalist. And then my lovely Juliana also going to talk to us about the effect this have, the induced effect the lockdown have on women. And so today, without wasting much time, I want to quickly introduce my good friend, Dr. Chibuna Wabia, a PhD in health services with a special concentration on healthcare management. Dr. Chibuna also is a registered nurse and also holds a master's in nursing. He's a CEO and the founder of Nurses Bond Incorporated, based in California. Folks, please enjoy Dr. Chibuna, who is going to speak to us in 8 minutes about the social impact on COVID-19 on frontline workers. Dr. Chibuna, over to you.
Hello, everyone. Good morning, good afternoon, and good evening, depending on where you are. Here in California, this is 6:46 a.m. and you can use that to know the time where you are. Thank you, Dr. Samuel Jacobs Abbey, for introducing this so that we can be able to at least share our own ideas and let the world know of what we are doing in this difficult time. Honestly, is a difficult time for everyone, most especially we that are frontline workers. It has not been easy. This caught us unawares, but we are doing something about it. So I'm going to talk briefly about the social impact of COVID-19 on frontline workers. For me to start, I know Dr. Samuel has done a lot of work, like to give us the background of and the numbers. So I'm not going to go towards that end. I'm just going to talk about, start with the general impact it has on frontline workers. Slide, please. Number one is this COVID-19 affects all frontline workers irrespective of social class, but with greater impact on those working on the underserved areas. So many hospitals, people work in rural areas. They might not have adequate PPE or personal protective equipment than those working in the urban areas. So many people don't even have ventilators, and it creates a huge impact on these frontline workers that have to serve irrespective of whether they have the enough protective equipment. Then it also creates tension on the call to serve of these frontline workers, especially with those that have underlying conditions. There are so many workers, so many frontline workers, they go to work irrespective of what they have going on in their lives. So with this COVID-19, they can't work, so it creates a huge tension on them. And it also puts frontline workers at risk of this virus, irrespective of where you work, whether you work in underserved areas or urban areas. It doesn't matter. It puts us at risk too. So the impact is everywhere, irrespective of where you work. Not only people working in the hospital, but also those working in the grocery stores, okay, in other places where people go to buy foods. So it puts a big tension if you don't know what to do on that. So the next one I'm going to talk about is the economic, emotional impacts. Emotional impacts on frontline workers. Number one is self-isolation or quarantine of some of the workers, depriving them of their families and loved ones. It is not easy, like you have to work and you also have to take care of your loved ones. But if there is any underlying conditions or you work, I know some of my staff that moved out of their family houses and rented apartments and rented houses because they don't want to work and still go back to their families. It is very, very emotional. And psychological stress and burnout has been on the increase. As you can see in the picture, there are so many people that have marks and scars in their faces because of excessive use of N95. Some people cannot even breathe. Imagine wearing, if you have not worn N95 before, you will not understand what I mean. Wearing this for 12 hours is not a joke. So, when you get all these marks and it creates a lot of stress. It's a lot of psychological stress on these frontline workers. And another one is the urge to serve, irrespective of whether there is adequate, personal protective equipment or not. Some people, some doctors, some nurses that have retired have gone back to work. They cannot just sit and see people die in their hospitals every day. They have to, brush up and say, hey, I gotta go there to work. So it has a lot of emotional attachment. So this has been a a lot of, emotions for people. So people also go into work, irrespective of whether they have adequate PPEs or not. And they do it because that is what they are called to do. So another impact I'm going to look at is the emotional impact. This is the social distancing. The social distancing, the impact it has on families. Imagine working 12 hours. Some people work, I remember when this started, we work 24 hours a day. And you come back home, you can't even go out for lunch or for dinner or for breakfast with your family. And because of the social distancing part of it. So it creates a lot of, emotions to you too. And the fear of co-workers and visitors in and around the hospital. Yes, there is social distancing, but if you're working as a front line, you don't know who the next nurse is or the next doctor is because you have to work together. There are some, you don't know who you are dealing with. So the social distancing is not actually real for the frontline workers because you have to work with people. You also have to work with these patients. So there is no social distancing between you and the patient that, that has this virus. So it creates a lot of impact. And the fear of other people where you go, like, you have to drive to work. You have to, go to gas station or fuel station to fuel your car. You have to go to grocery stores and other unavoidable places. So there is also fear of, the impact on, frontline workers after working, trying to save yourself in the hospital using adequate personal protective equipment, coming to the grocery store or gas station. So there is a huge impact. You don't know what to do. You don't even know, you don't even know whether it is in the hospital or in the grocery store or in the gas station. So there is this fear on that. So now the question I have is, what is the new normal? What is the new normal? Number one is we are now starting to accept what is before us and try as much as possible to tackle it. Either the curve is flattened or vaccine is introduced. As healthcare workers, as frontline workers, we cannot give up because this is what we have been called to do. We'll keep on, doing what we need to do, washing off hands, taking the recommended measures, okay, as much serious as possible to protect others and also protect ourselves. And we also do self-education, learning from others and adhering to the advice of experts, irrespective of what you study. If you're a doctor, if you're a nurse, wherever we see, watch the news, read CDC, WHO all the time to ensure that we are in line with what is going on. So the new normal, we just have to accept, but we have to work every day and continue to save lives, which is what we are called to do until there is, a cure to this or the COVID is flattened. So the next one is what we are doing as my organization, the Nurses Bond Initiative. Nurses Bond is a social network platform where we empower healthcare professionals through education and service. Now we have launched a campaign to donate PPE, personal protective equipment, to frontline workers in nursing homes and home healthcare agencies that don't have enough supplies. Their supply chains are not as strong as the bigger hospitals. So Nurses Bond is, initiating this like donations so that we can reach out to these people. We are connecting and networking through multiple social media platforms to educate people on what to do, how to be safe, even at home. Some are, some people have problems, taking care of kids, working from home, and, all those things. The emotional impact is too much. And we have launched what we call Aspiring Leaders Club. We have to raise future leaders in case this happens again or similar things. We have to do something about it. We have to raise leaders that can help us fight this, coordinate, and that can be on incident command center. Because when this happened, honestly, it wasn't easy. So we have to prepare. We have to prepare ourselves against this kind of things. Thank you, Dr. Samuel and everyone. And I'll be here for questions and answers. Thank you.
Thank you so much, Dr. Chibuna. That's a powerful presentation. And so, folks, I've received all the questions that came for Dr. Chibuna. We're going to keep the questions, and at the end of the presentation, we'll present it to the various speakers. and then they will be able to respond. Our next speaker, it's a chaplain, Professor Dr. Gerard Akama Onyari, is a servant of God of the everlasting gospel. He completed his MA in economics and geography from Elton University. He also holds a Bachelor of Arts degree in theology from Northwestern Christian University. He has an MBA from Africa Nazarene University, majoring project management. He also has an MA in development studies from St. Paul's University, also majoring in peace and conflict transformation. It's a PhD in professorship from the United Graduate College and Seminary International. Dr. Gerard Onyari is currently the executive director of the Kenya Peace Society and also the board chairman of the Jacobs Abbey Global Institute for Leadership Studies here in the US. Folks, please help me welcome Professor Dr. Gerard Onyari to speak on peace and security threats of COVID-19 in Kenya. Over to you, Professor.
Thank you so much, Dr. Samuel, for that elaborate introduction. And thank you for giving me an opportunity to share about peace and security threat of COVID-19 in Kenya. And as you know, the coronavirus COVID pandemic is a defining global health crisis of our time and the greatest challenge since World War II. We have never had such a crisis in the world, but now we can see through COVID-19 that the entire world is affected. There is nobody who can go for one's rescue. Every country is on its own, but God for us all. By now, most people alive know that the coronavirus COVID has infected nearly the entire 5 continents. The pandemic poses a significant threat to maintenance of peace and security, and there is a high possibility that it can increase social unrest and violence. What I mean here, the economies have been shut down. People don't have a job to do. Most companies have raided people, and this is a recipe for social unrest. Some countries have declared lockdown. Some countries, like my country, they have declared curfew, so people are not allowed to go out to work, and this is a very, very serious threat. And you know, Kenya, strategically, we are in the eastern parts of Africa, and our proximity to Somalia, where there is a suburb, the terrorist groups. So it becomes a threat in the sense that in a time like this, when there's lockdown and curfew, even the number of the security men is not enough. We don't know exactly what the terrorists are planning. And I'm very sure immediately we'll come out of this. I can sense that there's a likely they can attack, they can strike. And I'm trying to say the lack of international cooperation in the response to the crisis, exploiting the situation. I've said that every country is on its own. Small country, bigger country, and everybody are trying to fight the pandemic on their own. Considering the contagious and the nature of the virus and the measures taken by the governments in the region, the terror group could exploit the gaps in the security round. That one I've already said. But COVID-19 is much more than a health crisis, as Dr. Chibuna said. By stressing countries like Kenya, the pandemic has a potential to create a devastating socio-economic and political crisis that will leave the deep scars. What am I trying to say? My country in the moment is at standstill. There's no socio, political, or economic activities going on. Every focus is towards coronavirus. So it means the developmental activities which were set aside, even the agriculture, which is the economical backbone of our country, and most African countries are not at work. I'm proceeding to say, next. Consider, I say that Although the preventive against COVID have clouded that they decided for launching the direct restriction of the religious. Hear this. All the churches in Kenya are closed. There are no religious activities taking place in Kenya for the last 42 days. And imagine when you shut your country towards God, that is terrible. And what we are trying to say that COVID has shut down the world and it has brought up a paradigm shift on how we are trying to do our things. Next. I've already, next. Next slide again, I've already explained that. Cases of domestic violence has been reported in most countries, and you are the Secretary General of the United Nations trying to say that now when there's lockdown, when there's curfew, we don't know what is happening in families. And when we have got domestic violence in homes, this is a threat to security and peace. We have had gender-based violence because most of the couples who used to stay away and used to be at work, they are at home, and such cases have been reported. Next. We are saying that before the emergence of the pandemic, food insecurity was already on the rise in the region due to climatic shocks because of the climate change. There was livestock pest and disease that negatively affect the supply chain of producers and consumers. Imagine when the life was very normal. People were able to do that activity and we had food insecurity. What is really going to happen now that people are not working? People are not doing the agricultural activities. Immediately we are going to go over this. We are going to have serious humanitarian crisis because people will want to have food. Next. Let me have this to say. In 25th March in Kenya, when there was a curfew was announced, there were cases of brutality by the police, a violation of the human rights of the people. And when you violate the human rights of the people, you affect their peace and security. The lockdowns and the curfew in most cases have resulted in the loss of jobs and revenue stream because people work now only 10 hours. And Africans that work in the informal sector who depend on daily wages, increasing risk of food and insecurity are loss of revenue across the continent. So what will it happen if people don't have jobs? It will result to gangster. People must go to attack one another so that they find food to eat. Next. So what are the threats we are getting from the COVID-19 in my country? We have had loss of jobs. Business have closed down. We have had domestic violence. There is slow fight of terrorism against terrorism. And I've said immediately after this, I can project. They will strike immediately when this one is happening. And I hope the authorities will take them. I've talked there's food insecurity because now people are not working. We have had cases where children have been raped. And this can be resulting to pregnancies. They can get sexual transmitted diseases. Next. Next. Yeah, I can try to say that COVID-19 is going to have a serious security erupts and a threat to peace in Kenya and other African countries or other countries in the world. So the case here is that we should team up, work together, focus over this pandemic, bring it down so that life can come back to normal. Thank you. I will be there for the questions.
Thank you so much, Professor Onyari, all the way from Kenya for this powerful presentation on the peace and security threats in Kenya with regards to the COVID-19. Thank you so much. Questions have also poured in for you. We've noted them and we'll bring them appropriately. And I also want to welcome all and thank all our guests who are with us, both on Facebook, YouTube, as well as the Zoom conference. Thank you so much for hanging in there with us. So our next presenter, her name is Dr. Grace Faraja Kudubantu. Today I've done well. And Grace currently holds a PhD in human services from Warden University. She also holds a master's degree and a bachelor's degree. She focused her research work is on refugees. And so today we are so fortunate that Grace, who is the CEO of African Girls Foundation, African Girls Hope Foundation, will be presenting on the topic, the devastating impact on orphanages and refugees. Grace is based in Boone in North Carolina, originally from Congo DR and also from Kenya. Please, let's welcome my good friend. Grace, over to you.
Thank you so much, Dr. Samuel. I love the fact, the way you, I own two nationalities, actually three now. Yeah, yes, absolutely, I agree. I'm from the Democratic Republic of Congo, but I grew up also in Kenya, of which Dr. Onyari, we share so many things, and thank you so much for your presentation. Thank you so much, Dr. Samuel, for giving us opportunity to share from our heart and to share what has been going on around the world, and specifically to our specific portion of where our passion is as a community and also as scholars. As they have said, my topic is on the refugees and immigrants, and also with the impact that COVID-19 has done in the lives of refugees and also orphanages. When we see World Health Organization has estimated 1 billion of migrants, and we have around over 200,000 million of international migrants, and we also have over 70,000 millions of internal migrants. And of course, in Africa, we do also have refugees that have come from different places, from our own countries. And Kenya is one of the biggest hosting country after Ethiopia. Myself, I was a refugee in Kenya, and I can imagine and I can remember clearly how many different refugees that I met in Kenya. That Kenya is one of the countries that are hosting many refugees, especially from the Great Lakes. And when we say Great Lakes, these are countries that are close near Kenya, such as Rwanda, Burundi, Congo, Uganda, Tanzania. But many of the refugees that are in Kenya, they are from Somalia, South Sudan, and also Rwanda. And these countries have been through different atrocities and chaos from their countries, including my own country. So thank you to Kenya for hosting us. Thank you to Kenya for allowing your neighbors to have refuge to your country. And thank you to the government of Kenya that if it wasn't for Kenya to host these refugees, I don't know what would happen, because we found ourselves as refugees there in Kenya, and Kenya became a home to so many refugees. Many refugees there have grown in their spiritual life, in their social relationship. They have learned new language. I can testify that even refugees from Congo who now can speak some of the languages of Kenya. And I'm proud to say that Kenya have really given open to refugees to receive anything that they can as needed. And in Kenya, we have over 400,000 refugees. So back a little bit, Dr. Samuel? So the major impact that we have seen so far from coronavirus, COVID-19, we have testified famine in the refugee families. Go to the next page, Dr. Samuel. So as we have been interacting with different refugees in different countries, especially in the East African countries where we have a few of the members that we have connections with, and 90% of the refugees, almost 100% of each person that we have come across with, they have experienced the famine. Hunger is one of the challenges that is now happening in the refugee camps. Not only in the refugee camps, even the urban refugees. And this famine is not only in the refugee communities, even the orphanages, because refugees and orphans, they share almost same challenges, and also they share almost same as stakeholders. The people who provide for them, their international organizations, local organizations such as churches, families, friends that have come close to them. But now these resources, they have come to an end. They cannot provide anymore because of the economic crisis. So hunger has been an issue in the refugee and orphanages. Malnutrition. Parents are experiencing the white mares of children crying for a meal per day. Can you imagine that here in the United States? I have not had yet someone cry not getting food per day here in this country. But in Africa, it's a reality. Parents are experiencing hard time to provide meal for their children, just one meal. And why? Because there's now limitation of the sources where they used to get support. They are no longer supporting as before because of the limitation that COVID-19 has brought to this during this time. Yeah, organizations and churches, as Professor Onyera has mentioned, there's no churches that can no longer even visit their own members. And these churches have been trying to help so much their own community, refugee communities and orphanages. But because of the social distancing, they can no longer even visit these communities. So it's a very hard time that these refugees and orphanages are going through, and especially that they share same stakeholders. Health coverage is also another issue. As per my experience, also as a former refugee, although we have UNHCR in different countries, and of course in Kenya too, where I was a refugee, but UNHCR does not give a full coverage to the refugees. And this has been a challenging situation in the refugees around the world, because there's limitation. Okay, they will give some coverage, but not a full coverage when a refugee is sick. So there are some certain things that they cannot cover. And that's a very big issue. And many scholars have also presented this challenge, how refugees have been going through a health coverage limitation. Social security. Dr. Onyera has touched on that too. Let me give an example. When they say social distancing or curfew, and then you can imagine now how people are going to survive. How are they going to survive if they will not go outside or go and live as normal? Now, there's the insecurity in the lives of refugees and not knowing what to eat tomorrow or how the life will go forward. It's a very big issue. And also like in Kenya, there's curfew by 7 or I believe 6 p.m. if I'm not wrong, that everybody must be in the house. So you can imagine in case of any emergency in the house, and then you go outside and you meet with police. And let me tell you, police in Africa is not the same as the police in the developed countries. And you're in trouble. So before even you explain yourself, something might happen. So it's very difficult for in the lives of refugees and the orphanages leadership to take in charge of making sure that the community is well secured. And there's also increase of, let me do this. Yeah, economic crisis, which, sorry.
Increase of fear for tomorrow.
Yes, yeah, increase of fear, I've mentioned on that, increase of fear for tomorrow. This is, let me say, even us here in the developed countries, we are facing that. Can you imagine now the refugees who depend in the support, with the support of from others? It's more challenging in their life right now than even us who are here. Next. So what do we do now? Now that we know these issues that are going through with the refugees. Refugees and orphans are the most vulnerable people, because, you know, first of all, refugees, they are not in their own countries. They face already social services. In my previous research on experiences of refugee women with different physical abilities in Kenya, findings revealed that refugees do not have adequate social access as others. Why? Because there's that limitation on with the refugees. There are certain things that they can access and others they cannot. Why? Because they are refugees. And the same as in the orphanages. Orphans depends on the support of from other communities. And also COVID-19 has come as another big challenge in their lives. And this is a global economic challenge. And that is also affecting these refugees and orphans in our society in Africa. So what can we do? First of all, I want to emphasize on one thing. In the developed countries, we have the language that, and my friend Dr. First presenter explained very well what we need to do to combat COVID-19. And there's this language that we have been using, all of us here, especially in America and other places, that wash your hands, wear a mask, social distancing. Let me ask you, all these major 3 things to prevent COVID-19, how are we going to use it in the community of refugees? It's a hard term to use in the refugee communities and in the orphanage. Because first of all, wash your hands. In Africa, but it's already, we have an issue with water access. Accessing water by itself is it's one of the issues that has been there. And now in the refugee communities, telling them to wash their hands, how many times per day, it's a hard time to explain to them. First, they cannot even access water to drink, even couple times per day. So accessing water by itself, it's one of the issues. And second, wear a mask. They do not even have funds or money to purchase, to buy food. Where are they going to get money to buy mask? That's another hard term to explain to a refugee. Second, social distancing. In the refugee camp or even the urban refugees, how are they going to be social distancing, and yet they are all together and there's no way they can apply social distancing? Those are the major 3 times that I've been reflecting on that. It's very hard. So my recommendation
we are really running out of time. So if you can wrap it up, thank you.
Yeah, so my recommendation would be the UNHCR to increase refugee support advocacy. Also, the international organization to create a network mobilization emergency funds that will help this community, and also local organization also to be aware of the current needs that the refugees have, and also the orphans. Thank you so much.
Thank you so much, Dr. Grace, for that detailed presentation. Sincerely appreciate it. And we will come back with our questions as well. So now the next presenter, quickly, it's my very, very, very good friend, great scholar, Dr. Ada Okika is an educationalist and currently the executive director for Center for SDG Global Education USA, a member of the U.S. Federation of UNESCO Clubs, Centers, and Associations, and the Federation of Sustainable Development Organizations, where she developed strategic programs and organizes education and training, carry out researches into programs, and building top-performing initiatives. Dr. Inga is a recipient of the awards such as a Community Leader Award, Gender Advocate Award, and Women for the Millennium Award, and Global Ambassador for Women and Gender. She's a Global Ambassador for Peace and Gender Rights. She's committed with passion to the sustainable future of children, youth, and young adults, women and girls. She is a consultant to many internationally and presently the United Nations coordinator for Africana Women Working Group at the United Nations, a network of NGOs in special consultative status with the Economic and Social Council at the United Nations. Dr. Ada has earned many international accolades, including Commander of the Distinguished Kingdom Ambassador CDKA and Her Excellency designation for WMIL International Cabinet for Women of Life Ministries International. Folks, please help me welcome my very good friend, Ambassador Dr. Ada Okika, to present educational impact of COVID-19. Thank you so much. Please go ahead, Doctor.
Yeah, good morning, everyone.
Hey, good morning.
I hope I can be heard. Yes.
I can be heard loud and clear.
Thank you, Jacob, for that fine introduction. And thanks to everyone and those who call from Africa, the giant region of everything. Thank you, Doctor, for that input from all the way from Kenya. I bring you greetings from the hot zone of COVID-19, the New York City of United States. So I want to thank the initiative on the global impact of COVID and strategies for mitigation and survival. And I'm glad that I'm looking at the educational impact of the COVID. What actually has the COVID-19 provided to us educationally? Of course, we all know that from the beginning, the origin, it gave us knowledge about the origin of COVID-19 all the way from Wuhan, China, and its knowledge since December 2019. We also know that the World Health Organization declared it to be a public health emergency of international concern. Of course, by the time the United Nations headquarters shut down, in that there are three main offices in New York, Geneva, and Vienna, we know it has to deal with an international concern. It also recognized as a global health pandemic because it came not to stay, but to kill, because within 2 weeks, one is gone. You move on the road, the next moment the person is falling, and that's the end. So it became a global health pandemic on people, and education was provided on that as well. So, and apart from being a global health pandemic, it became the most contagious after the onset of its symptoms. Within 2 weeks, it became contagious, that even life around you, people around you are afraid. It created health and life challenges, and also created developmental and psychological gaps. Because as we just heard from former speakers, it affected the economy, it affected development, it affected families, even everything that has to do with economic and psychological needs of people, it has affected all. So education seems to be an impact, because through knowledge, through education, those informations we are provided about the COVID-19. Then what actually is the impact? Where has it impacted us? And I'm looking at how it has transformed oneself and society. First of all, we are able to know. It gave us education to know. Of course, we have just shared about the global perspective, the education about it, and the knowledge it has. It gave us the critical thinking about human life and general knowledge on health. Everyone is now conscious about personal hygiene, about life, about this COVID-19. So there was that awareness, there was that knowledge, there was that education that this thing is happening, this is going on. The information about global numbers of how it helps. So it gave people the awareness of transformation, self-transformation. You know, some of us that used to do certain things begin to adjust to the current pandemic requirement. So there was education of knowledge. It also provided education on what to do. What actually are we supposed to do about this pandemic? It provides education about the symptoms. We need to know about the symptoms. How do you know? What's going on with you when you have this kind of symptom? So it gave education about what to do about the symptoms, prevention, living behaviors, and research education on the pandemic. So it gave us this knowledge about doing things the right way. Some are cautious, wash your hands, do this, do that, in order to transform yourself, in order to prevent yourself, in order to protect yourself. So there was knowledge, education about what to do, you know, and also there was education about how to live together. You know, this is a time where it becomes a global concern that people now think about each other. You know, through WhatsApp, social media, families now want to know how you are doing each morning. As families come together to pray, even through WhatsApp, through phone. There was a lot of being togetherness. You know, it gave us the education of coming together, you know, caring for one another, knowing what to do, protecting each other. It also gave us knowledge about how to stay when you are in the public places, when you are in private places. What do you do? How do you come together? You know, and also it gave us also knowledge about the global network. Right from your bedroom, I can now hear someone speaking to us about COVID all the way from Kenya, all the way from California. So there was that togetherness, you know, through technological input. So there was the move on technology. Everything now is going online. So, and again, it gave us knowledge about knowledge education to be, how to be with each other. We all know that human beings are complex beings. Yet, education about COVID-19, the gravity of its pandemic on people's health, and instant cost to death has provided humans with education about how to be, giving consciousness to human existence. So the education about COVID is such, no, the pandemic, the COVID-19 pandemic is such an issue that we tend to look at both the bad and the good. It has both advantages and disadvantages. When you look at the advantages, we look at the global community. What is it bringing together? You know, at a time where even the presidents, the world leaders, are most concerned about their subjects. At a time, you can see most of them have to come out to the public to cry. You know, there are sleepless nights, a lot of things are going on. So there was this living togetherness, showing concerns, being there for one another. So there was this education. the COVID has really impacted greatly on this aspect of area. Now, what do we know about this deliverability? How are they delivered? You know, of course, I've just mentioned about the national consciousness about subject and citizenry. You know, the world leaders are not sleeping. They become conscious about their subjects. They want to care, you know. Then America, for instance, the president, they gave a stimulus pack, making sure people are able to eat. You here in New York, you go to transport, you're able to go out to medical care or anywhere, or to go to a job, the bus is, the transportation is free. So there was this consciousness about subjects and citizenry, how to make them comfortable in the times of this crisis. It also delivered the spirit of teamwork. You know, spirit of teamwork. You can see the diplomatic community liaising with the government, the national government, the health body, research centers. There was essential service workers, the medical team, the social workers, the educators. Everybody is like coming up, you know, to see what best to do. Some of the social workers are going to house to give them education, how to live, how to wear masks, how to move, how to distance yourself from one another. Even when you go to stores, to supermarkets to pick something, there was this teamwork of trying to create awareness. You go on the road, you see a lot of information being spread out. So their teamwork was established as a result of impact about the COVID-19. Of course, it improved technological accessibility. Everybody I know from, if Dr. Jacob can tell us how many people that can call from different parts of the world to this conference. That's as a result of technology. So there is an improved accessibility of technology. Those of us in the developing countries who are not used to technology began to learn how to use technology. It created lifelong transformation care on humanity. Now, the health of individuals, most times, especially we that come from Africa, we hardly take care of our health. Now it is giving us creativity. It's giving us a critical reasoning into our health in order to live long. It has also established passion for human health and life. Human health is very important. Now people are aware, I need to wash my hands. I need to do this before I need to take, make sure I don't have flu. I need to take this. You know, a lot of things are being provided in their own community. Some local people are even coming out with local treatments like hot soup, hot water, hot everything. Some are coming out with different herbal issues. So there is this passion of human health. All these are being done in order for us to live. People want to live. We don't want to die. Especially when you hear the high rise of deaths each hour. You know, it becomes frightening and you now become cautious about your own self. So what is now, how can we now harmonize all these impacts, educational impact on COVID in order to sustain it? Because what you are going now is sustainability. What we need to know that COVID-19 has come, just as one of the speakers mentioned, just like HIV and AIDS, Ebola, cancer, blood pressure, blood sugar, diabetes, all those things are now in existence. So having the knowledge that COVID-19, probably after lockdown we go, I think it's a fallacy that we will be deceiving ourselves. It has come to stay. Now, what do we do to prevent deaths, to prevent a spread, is to ensure that we become cautious. We become more cautious about our personal health, family health, siblings' health, you know, children's health. There is one of the media that mothers should also teach even their newborn how to wear masks. So how do we harmonize? We have to improve on interactive impact, interaction by health services, interactive educators, interactive reading about literature from the global community, the diplomatic community, what is coming on, the health experts, the research centers. There should be continued interactive education, interacting with one another, so that we'll be able to give out to the public what is needed, what is the correct information to kill fear, because the COVID-19 came out with high rate of fear. People became afraid of uncertainty. Some took it to be that it's end time. Those who said God has come to destroy the world. So there was high rate of fear in people. So interactive impact will enable us to ensure that the right information, the right vocabulary, the right language is released to people to keep them calm. Then teaming impact, of course, interactive impact is just like team, being a team, working as a team. No matter what we can say, the United Nations, the diplomatic, the global communities are now teaming up with nations, with presidents, to find out how best this can be solved in order to keep the world going. Of course, there should be continuity, there should be continuous impact. Without continuous impact, we are going to be locked down again. Now, we are talking about lockdown. Now, what is after lockdown preparedness? No education yet. So there should be continuity from now on. Continue about this COVID. Education has to continue. After the lockdown, what happens? How do we continue to educate people how to live, how to continue, how to beat themselves, how to protect themselves, how to manage the symptoms, how to take preventive measures? These are very important. Of course, the pedagogy of impact has to go, of course, to continuous training, continuous education, and palliative measures, trying to coordinate people, trying to calm their spirit through what we provide in the environment, providing their sustainable needs. So at the end of it all is that the transformation of persons and society through the education about COVID-19 has equipped us with tools and mindset for sustaining human life and overall health. And this has been the grounding information, the background knowledge of what we are doing. And what is it trying to do? We have to talk about transformation of self and the community, transformation of the society, transformation of family, into streamlined health, so that we can curtail this kind of high rate of death. In New York, for instance, funeral homes are filled up. Hospitals, morgues, and everywhere are filled up because of high rate of death. So there should be continuous education. There should be training. There should be more interaction especially after the lockdown. Now this rate is high, especially now we are locked down. What if when the community is open, people meet, go into transported public meetings and everything, sitting together? How do we cope them? Which means there will be more death if nothing is done. So there should be continuity in trying to harmonize and sustain the education gain or the education impacted on COVID-19. I thank you.
Thank you so much. Thank you so much, Doctor. Powerful presentation and the educational impact. We've taken notes as well. Questions are still here as well. So we have 3 more presenters and then we'll be wrapping up. So our next presenter is Professor Ituahini. He's an adjunct professor of accounting at Australia University in Washington, D.C. area, a graduate teaching assistant of internal audit at the University of Maryland, Robert H. Smith School of Business. He's also a CFO and a vice president of finance and accounting at the Federal Financial Institutions in Maryland and Washington, D.C. He was a master's degree in business and management from Robert H. Smith School of Business at the University of Maryland. Professor Ituahini is going to speak to us about the economic impact of COVID in Africa. Professor Ituahini, over to you. Thank you.
Hello, everybody.
Hey.
Thank you so much, Dr. Sami, for having me. I think you are doing a great job in the area of public health and in ministry. I've known you for so long, and I think you are doing an awesome job.
Thank you so much
for having me. And I see this as a great privilege. In a few minutes, I'm going to talk about the economic impact of COVID-19 on African countries. I'm going to be breaking my presentation in 3 areas. I'll be talking about the background of our economy prior to the pandemic. I'll be talking about the actual impact during the pandemic, and then I'll also be talking about the post-pandemic measures. All right.
Great.
So with the background, the impact of COVID-19 is likely to be felt in the urban areas of most African countries, since those contain most formal and informal sectors that are disproportionately concentrated in these areas. At the macro level, we are looking at more than 600 million people living in the urban areas of these places. Those areas also account for 50% of GDP. Manufacturing and service industry, which account for 64% of GDP, are also concentrated in those regions and are likely to bear the brunt of the pandemic. Small and medium scale accounts for 80% of employment in Africa. African countries such as South Africa, Tanzania, Angola, and Zambia were already facing fiscal challenges throughout the pandemic. We've seen sharp declines in demand for oil because of the global effects of the pandemic. Oil-dependent economies like Nigeria and Angola are likely to have budgetary challenges. In fact, prior to the pandemic, the IMF revised Nigeria's GDP growth for 2020 downward from 2.5% to 2% due to declining oil prices. But the good news, though, is that for non-oil producing countries, they may see surpluses in their budget due to drop in oil prices. So still talking about the background, the pre-pandemic growth estimate looked grim for most African countries as global GDP was predicted to grow at a slower rate at 2.5%, upwards for 1 basis point from the 2.4% in 2019 numbers because of investment and trade gradually being recovered. Most of these countries had issues with rising debt level and little foreign direct investment. Income growth was predicted to be the slowest in Sub-Saharan Africa, which according to a World Bank report, accounts for 56% of the world poor population. Productivity was also predicted to slow down due to weaker investment and efficiency gains. And most of these economies were really struggling because of their debt levels, so they wanted to restructure their debt. I'm going to switch and talk about the actual impact during the pandemic. I'm going to be talking about the aggregate demand and supply, which will create pressure on government budgets. First of all, consumer confidence will fall due to social distancing measures taken across various countries. This will lead to a fall in household consumption as well. I mean, you can take this and equate it to what you are doing in your individual household. Due to this social distancing, there's a lot of consumption that has fallen in most households, right? But most people are spending their money on food, which is a necessity. So that is going to be felt across the continent. This is also caused demand to fall in certain areas, right? Because people are not going out as much. So demand for oil is also going to go down, and as well as demand for non-essential commodities, because people are trying to find ways to save money and to take care of their basic needs, such as food and essential items. However, essential commodities could see a rise in demand. We are seeing a rise in the demand for food and healthcare supplies, right? Who knew about hand sanitizers being in short supply 2 months ago, right? But we've seen a rise in mask demand and then hand sanitizer and other things. But our aggregate demand is predicted to fall, while supplies may also fall in countries that are heavily import, right? As we all know, Africa depends so much on import. Inflation is also predicted to rise in most countries. As a matter of fact, the ECA predicts that over 250 million Africans in the informal sectors could be at risk. We can see consumer and expenditure will also see sharp declines due to COVID-related lockdowns and restrictions. With major investment in healthcare lacking, I personally foresee an upward pressure on government to invest in healthcare system during the pandemic. China, which is a very major player in most of these countries, is also dealing with the pandemic, so it's going to be difficult to rely on foreign aid. Next slide. Let's go to the pictorial view, which I got from the Brooklyn Institute on what's going on. So this is a very perfect picture of what's going on the economy in most countries. this kind of talk about everything that I've kind of talked about. So the first one is talking about declining consumption, right? So when you look at consumption, there are going to be restrictions on movement, such as social distancing and lockdown. So declining consumption is going to take place because of that. Poor expectations of future income for a gig economy and informal sector. As you know, most of the jobs in Africa are informal, where there's one-on-one trade or trade between informally organized. So there's going to be poor expectations of future income. And then there's going to be a huge erosion of wealth because the stock market is not doing well in most countries. All right, when you look at investment is going to decline, right? Because people are not flying in airports. Most of the borders in African countries are closed, you know, so investment from outside is going to decline. There's going to be so much uncertainty, right, regarding future decision making and poor expectations of profitability in investment spending. However, government expenditure is expected to rise due to expansionary fiscal policy and increasing in healthcare expenditure. This will ultimately result in declining net exports, right? Exports is going to go down because of the closing borders. There's going to be a disruption in the supply chain and then limited market for exports. Next slide. So finally, I'm going to be talking about the post-pandemic measures. I'm going to take a quote from the ECA, Economic Commission for Africa. They estimate that the economic impact on COVID-19 on African countries and cities are likely to be acute through sharp decline in productivity, jobs, and revenues, right? So what should we do as African and policyholders? We've got to look at the fiscal and economic stimulus to drive up demand. You know, as those in America can attest to that, you know, the American country economy was going down. So what they did was to send a stimulus package, kind of revive the small and medium-scale enterprises. And they were also good enough to send individual checks to people to strengthen up demand. We're also going to see heavy investment in domestic healthcare delivery systems. While internal measures are needed and would most likely be helpful, Africa in general and the sub-region should start thinking about an integrated approach to solving and dealing with the pandemic, as well as boosting trade efforts. So what's going on is that most countries are solving this pandemic by themselves. So I was very happy when they formed a committee, which is headed by the president from Nigeria, Buhari, to kind of look at an integrated approach to solving this problem. What was the point in solving the problem in Nigeria when neighboring countries like Benin and Cameroon are suffering, right? Because as soon as you open the border, all these guys are going to come in and spread a disease, and this disease spreads at an incredible rate. So what they need to look at is to look at an integrative approach to solving this problem, so the whole sub-region is covered in terms of dealing with COVID-19. We also have to look at increase in local manufacturing content, okay? So I've seen a lot of videos on YouTube and different places on how this COVID-19 has brought the ingenuity in Africa. People have started producing things that they would otherwise not think about. So what the government needs to do is to look at the local manufacturing content and kind of tap into this untapped resources where we can depend on ourselves and deal with such things, you know. So increase the local manufacturing content, invest in that area, reduction of government expenditures as they look for ways to bridge the gap in their budget. Our government expenditures in most African countries are so bloated with so many unnecessary things. So they need to start thinking about how they can restructure their budget and remove some of the things that are kind of pulling the governments down. We also have to start looking at investing in local technology and finding new ways of doing business, right? I call this thinking outside the box, right? So this has brought something new. So we also have to think outside the box. We've got to look at our logistics and supply chains and how we can restructure them to make them better. And introduction of cashless transactions by the banks. We need to move from the cash-based system to the cashless system as a result of this. So in conclusion, the COVID-19 is a wake-up call for our leaders, policymakers, and stakeholders, as this is a global problem. Countries that we usually rely on for aid are also struggling to get their hands around the pandemic. So this has made it nearly impossible for African countries to rely on foreign healthcare services as they usually do. I've heard so many stories about policymakers and leaders being flown outside the country where when they are sick, some of them go to South Africa, which is good for the African continent. Some go to England, some go to India, some go to different places. So now this COVID has showed us that no, everybody is struggling at the whole. So why don't we focus on our countries and our continent to build our healthcare system so that everybody gets an equal chance of surviving, right? We cannot solicit international support because there's competing demand for medical supplies. Therefore, like I said earlier on, a more integrated approach between African countries is required, including heavy investment in trade, healthcare, financing, and agriculture. I'll be on standby for any questions that you guys may have. I'm so happy to be here. I'll stay around and take any questions that you may have. Over to you, Dr. Sami.
Thank you so much. Thank you so much, Professor Etoani, for this wonderful presentation. On as you started speaking, a lot of questions have come with regards to the economic impact, and we'll probably get opportunity to answer one or two when the time comes. Our next presenter, which is our last but one presenter, it's Miss Juliana Ama-Plofia. Ama is she has worked in both civil service and also on the professional front for many years. She has over 10 years experience working in public policy issues. She currently works at the office of the President of the Republic of Ghana as the Deputy Director of Finance and Administration, contributing to and influencing government policies and monitoring their implementation at all levels. Juliana is the founder and the executive director of the Girls Excellence Movement, a youth development movement that has conducted monthly inspiration on the wheel outreach schools to inspire, educate, mentor, and inform and transform girls into great women of excellence. She earns a project management professional certificate in 2015 from the Project Management Institute while studying for her first master's in public administration at Chung Kong-won University in South Korea. She also holds a Bachelor of Degree in Political Science from the University of Ghana. Juliana is the first Ghanaian to be accepted on the prestigious Pentland Churchill Scholarship for the Executive Masters in Public Administration for global policy leaders, being handled by two great universities located both in the United States, which is the New York University and also the University College of London. Ms. Plofia believes the world will be a better place. The world will be a better place if women's voices are amplified in global policy, and she aspires to see more women in decision-making arena in the field across the globe to achieve that. Juliana is also a board member of the Jacob Sabi Global Institute for Leadership Studies. Please let's welcome my friend, Juliana. Please, over to you. Okay, it's Juliana. Yes, we can hear you. It looks like you are muted.
Thank you, Dr. Abe, for that introduction. Thanks to the great presenters that have gone ahead of me. Those were very insightful thoughts that were shared. Thank you so much to our listeners and viewers across the world. We are talking about the impact of COVID-19 induced lockdown policy that's being implemented across the world in different forms on women and girls. We've always heard in news items when the mortality rate is being discussed and it tilts the balance towards men, making it look like men are dying more, therefore men are being more impacted negatively by the COVID and its impact. But we are here to talk about what impact is it having on women and girls as well. And I say that just like war, the pandemic is impacting women as much as it is impacting men, and I dare say women are a little more severe at the receiving end when it comes to the impact, because their impact is post-COVID, the impact is still going to be with us. I say this because women are contributing to the fight, and that cannot be overemphasized. Women form a huge percentage of health workers fighting at the front line. And recently we read a very sad story about a 28-year-old woman who was fighting at the front line of this COVID-19 pandemic in London. She was pregnant and she caught the disease in line of duty, died and left behind the baby. That tells you what women are also facing at the front line. Women are bearing the burden of care for children and other family members as we speak. Women are responsible for the effectiveness of the remote classes for children, especially because in most traditional environments, even in the Americas and in the Europes, you have women are more given the family care responsibilities. And with children now at home, the burden on women to make sure that the online or remote classes are conducted and their children participate in it fully is very high. And that is also an impact. And the question I ask is, in all of these, how is everything impacting women and girls? The outline, we are going to be talking about the impact on financial security, the impact on safety or sense of safety, the impact on education, employment, and the impact on sexual and reproductive health. And we'll discuss also a few ways forward. The impact on financial security. COVID has sadly, actually, taken the fight for financial freedom, financial security, financial independence for women a bit backward. It has taken us a bit backward in the sense that most women perform or operate in the informal sector, especially in Africa and other developing countries. And even in developed countries where women perform in the formal sector, with the lockdown policies being implemented across the globe, these women are now home, trying to work from home. Along my discussion, we'll find out whether they're trying to work from home is actually really working. And we also want to discuss the fact that there's a lot of stimulus packages being given out by governments across the world to support workers and businesses that have been affected by the lockdown policy. The question is, how many women are benefiting from these lockdown-induced stimulus packages? Especially in Africa, where over 70%, or in some areas like Nigeria and Ghana, we have about 65% of our women who are petty traders. How many of these women are going to benefit from the stimulus packages being given out across the globe? How many of these women are captured in our national data for us to be able to even trace them to give them something? So we say that there's no accurate data. Therefore, these women will not be, who are performing in the informal sector, may not be able to accept, to benefit from stimulus packages, and this will take them backward in their financial security agenda. Such women are now vulnerable to abuse and exploitation to make ends meet. Some of them, there are stories across the internet that tells of how some house owners are demanding transactional sex in exchange for rent. So women who are trapped in homes that they cannot afford the rent because they can't go out to make money are now being forced to trade sex for rent to keep a roof over their head. That is a threat. The impact on safety or sense of safety, as I would love to put it. With the closure of schools and restriction of movement, it means that children are home, women are home. Globally, before COVID, the research shows that 38% of women globally experience intimate partner abuse. 37% of women murders of women murders are committed by intimate partners. My question is, with the lockdown policy being implemented, what strategies have we put in place to protect these women who are now being locked down together with their possible abusers? This is the threat on security and sense of safety for women. there's already research that has indicated that there's a high increase in domestic violence and intimate partner violence and intimate partner abuse, and even sexual abuse is on the rise. Before COVID, we all know that the domestic violence was the undeclared pandemic, but right now we are calling it the shadow pandemic. It is actually thriving on the lockdown policy because women are isolated from support systems and networks, and hence the pandemic is now, the shadow pandemic is now domestic violence. The other impact, which is the sexual and reproductive health impact. We all know that in countries that have a lot of numbers of COVID cases, the priority is now towards rescuing and preserving lives of those who have been infected by the COVID disease. And with that comes the threat of reprioritizing, which means that women reproductive health and related issues are losing priority spots. So pregnant women, rape victims who need a doctor's report and assessment to get justice, and all that are now going to be a second option to COVID cases, since they are now the main priority, and that is a risk. Cases, sexual reproductive health cases like endometriosis, women and girls who suffer that monthly. So in this situation where the COVID cases are now priority, what strategies do we have to protect women who are going through such problems that will not wait until COVID is over? This may lead to increase in maternal and infant mortality rates. Unplanned pregnancies are going to be very high, and we are all going to see the repercussions after the lockdown. Teenage pregnancy is going to be high, and of course, unsafe abortions are going to be here with us. And with unsafe abortions will come female mortality rate going very high. The upstage of teenage pregnancy and unplanned, as we have already talked about, is very inevitable under this lockdown. The impact on education. Now children are home. They need to participate in online education. How many of these homes actually have technology to access this education? And in homes that they have technology, already ITU reports tell us that men are more open and skilled to use ICT more than women. So in this situation where most women are now, most women are now responsible for making sure their children participate in these online classes, do not have the requisite skills to guide them properly, meaning that education is going to be affected. No doubt, the care of burden is on women. House chores and other things are going to be competing with learning timetable. And I dare say that reinforced gender roles may lead to an increase in girls dropouts from the classroom after the COVID lockdown policies are lifted. And even while the lockdown policies are still in place, most of these girls are not participating in these online classes, as research has shown in the US that majority of these online classes, children are absenting themselves from it. And that is mostly because women lack the ICT skills and even proper access to be able to guide their children to participate properly in this program. Impact on employment. Imagine a mother. Imagine a mother conducting an online professional conference, and a 6-month-old baby who hitherto the lockdown policy would have been in a daycare, or the mother would have had assistants around the house to take care of that baby, now has to take care of that baby alongside the online conference. How is that going to be? So I say that multitasking remote work responsibilities with childcare will definitely compromise productivity and performance of women. In the long run, when the performances are not up to task, definitely women are going to be losing their jobs more as compared to the number of job losses that men will suffer after the lockdown policy. And this will increase the inequality gap. On the way forward, we've discussed all the pain and everything that women are going through. Of course, rape and all other things are there, and there's the lack of immediate access to shelter and all that. I want to say that we need to use or include or amplify female expertise in teams that are handling the strategies towards mitigating COVID-19. The reason is that when all male decision makers come up with policies, it lacks the aspects that will really affect family life. Not because men hate women, not because men don't know, it's because they haven't felt it, so they can't really articulate it as properly as a woman would have. And they can't come up with solutions that will be as effective as women would have. So I'll suggest that moving forward, let's amplify women expertise, let's amplify women experiences and women ideas in formulating the policies that are targeted at limiting and eradicating COVID-19. That will end up reducing the impact post-COVID-19. I also want to say that we need to designate shelters, more shelters. I know there are existing shelters across the world, there are a few in Ghana, but in this time when women and children are risking their lives being locked down with possible perpetrators of abuse, there should be designated shelters to take care of these people. We also need safe places and reporting centers so that women can report easily. We also need to increase advocacy so that as we have both men and boys mostly at home at this time and mostly glued to their computers at this time, this is the time to increase awareness and education targeted at them so that we can make the world a place for women and girls and in fact for families during and after this COVID-19. Thank you. I'll be here for questions.
Thank you so much, Juliana. Thank you for that powerful presentation on the issue of domestic violence and its impact for COVID-19. Now, our last speaker, it's Dr. Anki Wixit. It's a PhD. So Anki is an agricultural engineer and has a PhD in bioethics, sustainability, and global public health, with more than 18 years of experience in tropical agriculture, value chain development, and agribusiness in Eastern and Southern Africa. Currently, she is the co-founder and the chair innovation and business management of the Farm Biotechnology and Traditional Medicine Center.
Hey, yo, you. Can you eat your food though?
So,
you want to go outside?
I think somebody is interrupting us, but it's okay. We'll handle that. So Dr. Anki, currently based in Uganda, and she's a lecturer at the Imbara University of Science and Technology. She's also an external expert to the European Commission already in 2020, and a co-founder and the treasurer of the board of the Agribusiness Incubation Alliances of Uganda. She's a consultant to the United Nations, the World Bank, the World Health Organization, the German Agency for International Cooperation, among others. And she's also a board member of the Jacobs Abbey Global Institute for Leadership Studies. Please, all the way to Uganda, let's welcome Dr. Anki. Please go ahead.
Thank you very much for the elaborate introduction. As he said, I'm co-founder of Farm Biotechnology and Traditional Medicine Center of Bara University, and we are responding to COVID-19 Next. About us. Farm Biotechnology and Traditional Medicine Center is one of the 24 Eastern and Southern African higher education centers of excellence, ACE2 program. These centers were established the support of the World Bank in African countries to spearhead research on excellent ground. Bio University was able to secure one of the center, and this is our team. What we are doing training, postgraduate, PhD and masters, and we are providing short courses for herbalist, medical professionals, the general public. This is different levels of short courses so that the audience can follow the training very well. We are also doing research in various fields on natural medicine and cosmetics. The goal is to build a critical mass of specialized and skilled human resource that can advance traditional medicine and farm biotechnology for socio-economic development in Africa. Vision of our center is to be a leading African center of excellence for training and research in traditional medicine and farm biotechnology. And our mission is to contribute to documentation, validation, and value chain development of traditional medicine and farm biotechnology products for use in phytopharmaceuticals, biopharmaceutical, nutraceutical industry in the region through training, research, and community serving for sustainable development. Next. Here you can see our framework. We are in the middle. We are working together with private sector and development organizations, and also collaborating with university and academic research centers. On our left, we have the traditional medicine indigenous knowledge holders who either have a challenge or an opportunity in the fight in various aspects of life, meaning not only in health, it could be in agriculture, pest control, and in other areas. And through community outreach and interface, we are identifying the opportunities and work with traditional knowledge holders together. And what comes out of our center is we have entrepreneur spin-off companies that is have either started or will start small enterprises to promote their products they have learned in advance during their training. And our center also provides experienced professionals and scientists for the public. So this is our input and output. Next. Now COVID has also hit Uganda. When you go to the chat window, you'll see the statistics in Uganda. They are not too frightened. We have 85 confirmed cases, 52 have recovered, active case are 15, 1 is reparated, and 16 self-exit. So that is our statistic in Uganda, quite promising, not so threatening than other countries so far. And I hope that will be like that. So Farm Biotrack is now approaching the challenge into 3 ways. 1, production of affordable hand sanitizers in gel and liquid form. The second is identifying of antiviral medicinal species. We are using literature review, and we are using also ethnobotanical studies and interaction with the indigenous and herbal medicine practitioners. And the third, production of active pharmaceutical ingredients. So these are three-pronged approach, and I will briefly mention each in detail. Next. Yeah, here I have already mentioned the hand sanitizer. It's made with ethanol, and we're using for the liquid the WHO prescribed guideline for hand sanitizer making. Then exploration of local production of chloroquine, that's just an example of active ingredients. They are now a team working on that, on the third medicinal plants, which have either from the literature or from the knowledge holders a claim of antiviral. Next. So the idea came from our pharmaceutical pharmacists to make hand sanitizer. On the project has embraced the idea and went ahead and supported the technical team, supported the innovators to make hand sanitizers, which is affordable and also standard quality. Why we're doing this? During the pandemic, the market is overwhelmed with supply. They cannot supply the demand, and therefore the prices increase. So when we are being one more player in the market, we can reduce the price by having more supply, but also offer quality. In Uganda, I have observed when I go to different shops and I have to sanitize my hands with what they have, some they say, yeah, that is hand sanitizer, but when I smell, there's no alcohol in it, diluted, and some using soap water to wash your hands with soap water, but unfortunately not washing, but just using as if it's hand sanitizer. So it's not appropriate. Next. Yeah, why research on active ingredients? As you may have known that when an epidemic, especially a pandemic, breaks out, some exporters like China, like India, who export active ingredients to other countries, have made in a high alert to say, oh, when it's happened next time, again, we can close the market. So it is very good to parallelly to importing, also have the capacity to produce it ourselves, even if the price is high. Yeah, because in the pandemic situation, it's not the price, it's usually, is it there or it's not there? But if it's, even if it's double the price, only double, a country can still afford local production, which may be more expensive because it's smaller quantity, also less bulk, and therefore more expensive than maybe the large producers. For them, it's easier to produce. And what we're doing, we are reviewing various off-patent methods of synthesis. And this is a long term. We cannot respond to this pandemic, but this helps us to think about homegrown solution of producing essential active ingredients. Next. Why we need antiviral plants? Medicinal plants are a source of new and novel compounds, addressing existing and future challenge of disease prevention and treatment. As we know, there is a limited amount of medicine available on the market, and diversifying these treatment options is very important to treat this current challenge of COVID, but also future challenges of biological pandemics, bacteria, viruses, or parasites. And plants can give us a chance of sourcing more diversity in treatment option. And using plant medicine has an advantage to the economic too. It's increasing the farm income options, medicinal plant cultivation. And when biodiversity is sustainable use, when people see a use in the biodiversity, they're more likely to conserve forests and biodiverse hotspots. Next. So here are the examples. In general, what is under review are several plants. It's just a plant, there are more, there are about 20 plants. And the literature research reveals that these various plants have activities against COVID-related viruses and other viruses. That is a starting point for research. We, as Farmwriter, we cannot claim that we have cure for COVID-19 because we need now the evidence using the COVID-19 models to actually say, yeah, we have medicine based who others claim these compounds are against COVID. We cannot claim it from ourselves because we need first to do the research before you make a claim. But there is a chance that there's a good promise, but we cannot yet claim. Next. Thank you very much. And here are my details. Feel free to contact me for further discussion. Thank you very much, and I wish you a good discussion.
All right, thank you so much. Thank you everyone for joining us. It's been a great pleasure. There are tons of questions, tons of questions, and we have over 900 people joining us for this conference. Before I go into the questions, I want to ask those on Zoom, if you want to ask a direct question, I want to give you the opportunity. You can just unmute yourself and ask your question directly to each one of the individuals that you want them to answer the question. And then I will also, we have about 10 minutes to finish the whole thing. So please, you can go ahead, straight question, straight answer. So if you want to go ahead to speak, you are welcome to do so right now.
Right. My question is practically reality. How true is COVID-19 airborne contagious? And if the lockdown is being lifted and I'm traveling at about 9 hours in the air, maybe the medical doctor can answer this question. How safe is it to be in an enclosed environment like a plane for that kind of a long distance of about 9 hours? Thank you.
Thank you, Mr. Ebenezer Okra. Dr. Chibuna, you want to take that question?
Hello, Dr. Okra. Thank you so much for the question. Thank you. There is difference between airborne and other, what's it called, infections. So airborne means that it circulates with the air, and this is not, it's not declared airborne. It is, what is it called? Let me just keep my mind, but is a droplet. Droplet means, yeah, that's what I need. So droplet means that if someone with COVID-19 sneezes or coughs and, you know, the saliva touches somewhere, and it happens that it touches you, your hand, that's why we encourage everyone to wash their hands, and you use it to touch your face or touch your mouth, so you can get it from there. So if you see the major things that we tell people is to use mask and wash your hands properly. So that is what it is. So it's not actually airborne. Airborne means that it circulates in the air. So if COVID-19 is airborne, it would have affected more people than, like, it means that you can go outside and the breeze that you want to get will contain the virus. So this is actually a droplet. That's why we are using droplet precaution, which includes washing of hands, social distancing, and using of masks. So if you are on the plane going far, as long as you cover yourself and as long as you are not touching things, or if you touch things, you wash your hand very well, then you should be okay.
Thank you very much, Dr. Chibuna. One more question from the audience before let's go ahead, Professor Ambrose.
Thank you. First of all, I am very impressed with what I've listened today. from all the participants and those who presented this topic. Now, my question is this. The effect of this COVID-19 seems to be more severe in high-income countries like the US, Italy, China, than low-income countries, who most probably do not observe social distances and have poor living conditions, and they live in great quality in the house than advanced countries. Can you explain why the reverse? I mean, when normally these conditions in advanced countries, people are suffering more than, people are dying more than in low-income countries. Can you explain why the reverse? When in actual fact, we probably will have been having more deaths in low-income countries like Nigeria, like Cameroon, like Ghana, like Kenya. Can somebody answer that for me, please? Thank you.
Sure, thank you so much. Which of the panel want to take that? Not Dr. Chibuna. So somebody else want to answer that quickly? Somebody want to answer that quickly? The question.
I can jump into it.
Yes, please go ahead.
Yeah, I can quickly jump into it. Number one is in the advanced countries, we have so many what's it called, technologies to quickly detect whatever is going on and they report the cases. But in underdeveloped countries, they don't even have testing centers. They don't even know what is going on. There are deaths, but so many of them don't know the cause of death. But in advanced countries, once anything happens here, you know and recognize it immediately. So if you are talking about those countries that have reported low cases, probably there has been death, but they don't have the advanced technologies to detect immediately what has been causing these deaths. That way, they're not. I'm not sure they are reporting accurate numbers because if you don't have advanced technologies to test immediately, how would you be able to record advanced numbers? There is COVID-19 actually, but how are they tracing it? What measures are they using to report it? What test centers, how many test centers, or what test apparatus do they have to test everybody? So that is what I can say that is happening between the advanced countries and underdeveloped countries.
Thank you very much, Dr. Chibuna. A quick question for you, Dr. Ada, in New York. So the question said, do you think the traditional educational system should be rendered useless and revert to online to accommodate more? And how do we also ensure that countries with low technologies will ensure that kids of all kinds will have access to education?
Yeah, thank you so much for that question. I think that question is really a question of concerns to all, because it's only the developed world that the technology education is going on. When you go to developing countries, the children are not in school. So it's a problem. So I would not recommend that traditional education should be written off. But what is important is not just the education, but try to bring up preventive measures that can sustain health of people from the pandemic. Because if you say schools should stay in the house, assuming we have every facility, technological facility available for everyone, every kid to study from the house. What about going to the market? What about going to churches? What about visiting, going to public places, meeting people in public functions? So we still have not solved the question. So having a compulsory online education for all kids shouldn't be the priority. I don't think it's going to be the correct option to face the pandemic. But what is important is to provide more available resources that can help in managing the pandemic. Now, I know in some hospitals, there are some policies that want you to go for checkup every month or every 3 months or do blood work or something like that. Such a policy should come up in time on this pandemic, because if care is not taken, even if the kids are at home studying, assuming it's well taken, that traditional education should be eradicated and every child is made available to technology education. What are our parents going to work? What about occupants of the family going out and coming in? So it's a menace that we are thinking about. The pandemic is really much. So traditional education should not be fully eradicated, because for you to instill this technology is capital intensive on government, on everyone. So the bottom line is to provide available and necessary education that can prevent, control, and also sustain people even when the pandemic is still on.
Thank you very much. A question for you, Professor Etuaini. And the question is, should African leaders accept loans to fight COVID-19?
Yeah, thank you so much for the question. This question is really loaded, and there's no one answer to the question. But ceteris paribus, which means all things being equal, I'll say no, right? But as I said in my presentation, different countries were already having fiscal issues with their budget. So if there's nowhere else to look, then sometimes an external loan is needed to help fight this problem, right? This is an emergency situation. So if you don't have any surpluses in your budget, then you've got to look outside for loans. So what's going on is that the fiscal challenges that they are having, they're seeing decreases in import tariffs because the borders are closed. Exports are not also going on, it's slowed down. Labor market is down due to social distancing measures. VAT is also down because there are no sales and production is not going on. So there's huge declines in their budgets, right? There's huge declines in their budget. So what the government should be doing is looking at their expenditure as an organization. We are doing it at my job. We are looking at our expenses and cutting down anything that we don't need to do. We don't need to have to make sure that we can have money generated internally. But I mean, look at oil prices in Nigeria, for example. Nigeria is going to have huge problems if the oil continues to decline, right? Because about 60% of their revenues is derived from oil prices. I mean, I know gold prices going up, but there are no export markets, right? Because the borders are closed. So it's going to be a huge problem. I know Ghana was working on a loan, $100 million loan with IMF. I don't know how that came about, but I think that's what is needed right now in an emergency situation. But the government should be very proactive going forward in thinking about their budget and what to do going forward to make sure they have surplus in their budget.
Thank you very much, Professor Etuaini, for that question. Another question here, and this question is actually for Professor Gerard Onyari. And Professor, the question here is that with all the investment that world leaders have made into nuclear weapons and armories, what has COVID-19 taught the world?
Thank you for that question. I don't have the updated figures, but the figures I have from 2017 January to 2019 January, more than 18 top nuclear weapons in the companies in the world, they invested more than 748 billion USA dollars towards nuclear weapons. But what I want to say that COVID-19 has taught us some lessons. One of the lessons it has taught us is that we need to have a unified or united approach toward the health system in the world. The second lesson we have learned from the COVID-19 is humanity is one and we are interconnected. And in that, we must also try to forge creative partnership in the future, digitally, on how we have to work together around the world. Because I see this now, every country in the world, they are on their own. Every country Kenya, Uganda, United States of America, United Kingdom, anywhere, Ghana, Nigeria, they are doing on their own. But in the future, COVID has taught us that we have to work as a team. Two more of the resources, and I entirely agree with Professor Edward that going for the loans to fight COVID is we are entering ourselves into another trap because we have high debts. So we have to restructure and give more money to the health sector. We need to have early warning system. COVID-19, when it came into being, people took it as a joke. They never took it serious. If they could have taken early warnings, we could not be where we are. But in the future, we have learned that once we have gotten a trigger of the warning, we need to take it very serious. The other lesson we have learned that all the schools, universities or institutions are closed. What happens to the children who come from vulnerable background? They are not studying. So in the future, we should need to see how to all children going to school around the world, how do they access the, digital learning? And finally, what we need to do here is that, especially the developing countries, like Dr. Chibuna has tried to say, that there is no testing which has been taken place in Africa. My brother, let me tell you that in Africa, we have God. It was prophesied that we will see a lot of dead bodies in the street. It has not happened. Our strength is God, and God is going to help us. Those are some of the lessons that we have learned. That one of the things, again, we are, those who are Christians and who believe in Christianity, we have gone back to the first century where we were having churches in the homes. So, and I want to end by quoting the Prime Minister for Italy. And you know, Italy, they have got the best doctors, the best hospitals. When they overwhelmed, indeed, he made this remarks that they only need divine intervention, and that divine intervention has to come from above. So Africa, Dr. Chibuna, we have God and we are on our knees. Thank you.
Thank you very much. God bless you. Thank you so much. Shahanaz also added to your contribution by saying that COVID-19 teaches us not to fight anyone. Rather, we should become united and emphasize on the health system management rather than putting a lot of money and resources into weaponry. Thank you so much. The next question that I have here is for Juliana, and the question is: is it that we are already violent in nature, and COVID-19 is helping to expose it?
I would say that violence is not gender identified or gender specific, so violence can be from both genders. I would rather say that the COVID situation is exposing existing inequalities, existing patriarchal structures that places women at subordinate position to men. And this subordinate position disadvantages women since they don't have financial independence, they don't have the right qualification to get the best jobs. Even when they have the same qualification and they do the same job at the same speed with a man, they are paid less than the man. So these inequalities are the ones that result in abuse. And these are what COVID is actually exposing.
Thank you very much, Juliana. So the next question here, it's also for Grace. And it says, what plans should social departments from various countries, especially in local countries like in Kenya or in Congo DR, where you are originally from, should put in place to protect these girls?
Thank you for that question. As I mentioned before, that already social services, refugees have been experiencing already not accessing, have enough social services. So my first recommendation will be that social services department should, number one, give full health coverage to these girls or to the refugees. Second, because that has been a big issue. Second, social departments should also provide a food security to these girls or to the families of vulnerables. And third, you know, there's mask or sanitizer that prevent for COVID-19 to be spread. But again, if social department can provide a free sanitizer to the family so that they can practice how to prevent COVID-19 in their community and in families, that would be greatly helpful. So my biggest recommendation is for social department to provide free materials that will help these girls to be protected from COVID-19.
Thank you very much. Now let me go to Dr. Anki in Uganda. So there's a question here. I know you love this question. And the question here says that why is the Center for Disease Control and the National Health Institute not focusing on traditional medicine? Because in the news, all we could hear is Dr. Fauci and all those trying to look at orthodox medication. But why is these institutions not interested in traditional medicine, knowing the fact that before the introduction of Western medicine, we have leaned on herbs and traditional medicine? Why is it that the CDC and the NIH not interested in traditional medicine?
Thank you very much. This question should actually directly be targeted to these institutions because I can't speak on their behalf. What I can say that because traditional medicine, natural medicine, may not have the scientific recorded backup, and therefore insurance systems in many countries cannot support traditional or also complementary practices. That is a general issue. 2, research and development funding is little for traditional medicine. If you go to the WHO report on traditional medicine, you see that they are reporting 60 to 80% of Africans use traditional medicine as their primary or sole health care. Now, just make your own study to flip down the report and go on the last page where usually the finance is and check if there's 80% people using the traditional medicine. Could it be that there should also be a higher percentage of funding go towards promoting the research, the development and production of traditional medicine in general? That is my issue, is actually that the sector traditional medicine seems to be underfunded from wherever funds come in. Thank you.
Thank you very much. We really ran out of time. One more question for you, Juliana, here, and then I will wrap it up. So the question here is that with regards to strategies to reduce violence against women, the approach seems to be more of women victims or survivors, and not perpetrators. Why?
Okay, so there's actually an approach for perpetrators where I said that we need to do targeted education and campaign targeted at boys and men since they are currently at home and glued to their gadgets. And we should target these approaches to them, because the other way would be to arrest perpetrators, and the court systems are quite shut down right now under lockdown. So nothing much can be done about punishment or changing, but then changing mindsets is what I was proposing and what I would advocate for, which is design campaign material, design education about the violence and its repercussions on human life, and target it at boys and girls, boys and men, since they are at home now. And once they start getting their mindset changes, then the effect on women will become lesser. For instance, if men are educated at this moment to help with the house chores, and that will take away a bit of the pressure and release the women to participate in online work, and that will preserve some jobs. So that's what I mean by targeted education for boys and men.
Thank you so much. So let me wrap it up by saying that I want to take this opportunity to thank all of our speakers. Great insight, great presentation, well-researched, well-presented. I'm very grateful that you spend your early morning if you live in Northern America. And I also want to thank Professor Gerard and Dr. Anki. You know, you are already in the evening there, and Thank all of you for your great presentation. I want to thank our audience who joined us from all over the world. I saw my good friend from Argentina, Andrea, long time. I'm so happy you were able to join us as well. And also Shanadels from Bangladesh. And all the people who joined us, we have close to 900 people who joined us today. And I must say that this is just the beginning of the conversation. There's going to be a second series coming up in the month of June. So watch it out for another great conversation in the month of June. And wow, it's 10 p.m. in Bangladesh already. God bless all of you for your time and your resources. I must say this, that COVID-19 took the world by surprise. But like all our speakers have suggested, as we synergize our energies together, we will fight it. We will follow science. We will respect science. We'll also pray, like Dr. Gerard said, and all the advices that came from us, from our panel, let's follow it. And what is good when you have information or you have a resource, but yet you never utilize it to achieve the purpose goal. So we will be great failures if all these presentations that have come from our great resources is not implemented. I want to encourage each and every one of you that what you have learned today, share the word with the rest of the world and help the rest of the world to fight this pandemic. And I'll see you again in the month of June as we continue with our series. God bless all of you. And once again, thank all of you for your time. And at this point, we call this meeting a close from the Jacobs Abbey Global Institute for Leadership Studies based in Washington, D.C. area with the support from the World Health Organization. Enjoy the rest of your evenings, your morning, your afternoon. Stay safe, everyone, and be blessed. Bye-bye.
Thank you.